Dr. PSV Rao, who's a senior surgeon, is joining me live on the broadcast. Sir, thank you for speaking to us and appreciate you joining me at this point of time. What importantly needs to be looked at this point of time is yet another threat, which with all in fact fears in our head we are looking at, and if we go by the reports that we are tracking from social media, there is also a possible scenario that a state of emergency could have also been declared.
Yes. There are three important issues here involved. One, we know from the past the Chinese are very opaque. So they are not going to reveal the actual state of affairs. And this is what they did with the pandemic. And they also did with the SARS-1 pandemic also. Second, it has always happened in December. And the virus has spread to the rest of the world in January when they have the Chinese New Year. So these are all things which will be very we have to be very concerned about. And I think we have to be very careful with all those who are coming by flight or by other transport from China. And if there is reasonable reason, there are all these videos, and if they are true, we should start checking for anyone who comes from China to other parts of the world, including to India, so that we don't get these viruses coming here. We still don't know if it is a new virus or it is the new variants of the existing flu, influenza, and coronaviruses. It is the influenza and coronaviruses which cause all these problems. And though we have vaccines for the old variants, this may be a newer variant, and our vaccines may not be effective against it. So we need to be checking anyone and everyone who comes from these countries for fever and for any evidence of flu.
Mr. Rao, but as in fact everybody is naturally very concerned and worried, as the symptoms highlight that they are of the similar nature as that of COVID-19. Are the vaccines equipped enough that we have got, we have in fact been provided in the case of COVID-19 going to be anytime preventive going further with this virus that possibly could also be transmitted into our country?
See, influenza virus vaccines have been around for quite some time, and the influenza vaccines are updated every year. Actually, every 6 months. Once for the northern hemisphere, where the flu is in December, January time, and another 6 months later for the southern hemisphere when it is in the June, July time. And whereas the coronavirus, while the pandemic was on, and there was updating towards the end of the pandemic to the new variants which came up. But now we don't know what this new variant is. So and the China is not going to reveal anything. From the past we know they are going to be very opaque about the whole thing. And they are not going to reveal to WHO or to the rest of the world. So we have to be patiently, we should take preventive measures. And if the virus does spread, then we will be able to identify what is the variant and if our present vaccines will work against it, or we will have to update it, both the influenza vaccine for influenza virus and the vaccine for coronavirus.
Sir, after the learnings that we have got from treating, in fact, and battling with the COVID-19, what are the preventive measures that we can collectively look at into understanding that what needs to be done at this point of time to act on the very first instance and not just let the transmission delay to cause further transmission and now getting into an outbreak till an impact that many lives are again lost, like we have seen in the COVID-19 pandemic?
See, in addition to these viruses which may come from China, we have enough viruses here in every part of the world itself. And these flu-like attacks occur in this part of the year. So the main thing we can do is to take preventive measures like wearing ideally N95 masks, avoiding very crowded places, and avoiding unnecessary travel. The mask will reduce the amount of viruses we will inhale. These are all airborne viruses. So it will drastically reduce that so that our immune system is better able to take care of it. Good nutrition and proper healthy lifestyle adds to the strength of our immune system. So these are things, plus we should avoid unnecessary exposure to cold. Mask also keeps the air we breathe in warm, because part of the air which we breathe out, the moisture and the warmth is retained in it, and it moistens and warms up the air that we breathe in. A very well-fitted N95 mask is the most important thing, and avoiding unnecessarily crowded areas is the second important thing. Thirdly, keep our health with nutritious food, good lifestyle, and exercise.